No matter the size of a hospital, they all have one thing in common, their need for talented EMT workers. The team at Kiowa County Memorial Hospital in Greensburg shows us how EMTs and paramedics are integral to the daily operations of healthcare facilities.
Here at Kiowa County Memorial Hospital, we provide clinic, hospital, outpatient, and emergency services. We are going to take a look inside the EMS department and show you what it looks like to be part of the KCMH EMS team. Two of the EMS crew will join us with their stories on being part of EMS, one new and one with a long history of experience and growth in emergency services.
Hi, my name's Corbin. I'm an EMT and a CNA here at Kiowa County Memorial Hospital. I have been here for about 5 years. I started when I was a sophomore as a CNA. Well, I kind of wanted something different from CNA, and EMS was interesting to me, so I decided to give it a shot, and I actually really like it. Currently, I'm taking my AEMT, which is the Advanced EMT. I'll be able to give medications that are out of my scope now as an EMT, and I'll be able to do IVs and different skills. But I do plan on being in it for many more years.
Training is ongoing in EMS no matter what role or level each person is in. EMS at KCMH supports the growth and learning of all of the EMS staff whenever possible.
So when we get calls, we load up on the truck, and then we go to the address for dispatch to. Once we're on scene, we assess our patient, we take their vitals, we see what's going on, and then we either give treatments needed at their house, location, wherever they're at, or in the truck, depending on the situation, severity of how much they really need it. And then we go en route to the hospital, and then we unload them and hand off our care and the patient to the ER nurse and the ER. And as a CNA, you might be able to see your patient you had brought in earlier in the past week and care for them and just help them with whatever they need.
EMS provides emergency care for the Kiowa County community and provides the highest quality care for the most critical patients. In most cases, patients are brought to KCMH to be treated in the emergency room. EMS will cover 24 to 48-hour shifts in most cases.
I've been involved with EMS since 2009 in one way or another. 2009, I started out as an ambulance driver, got my EMT, then went and got my EMTI. Did that for about 5 years, stepped away for a year and a half and realized I was missing it, got back in it and started the journey all over, got my EMT, got my A, my paramedic, my critical, which led me to coming here and being the journey.
So in approximately 2021 or 2022, the hospital and EMS combined to work together to create a service that could provide 24-hour coverage for 911 calls. In doing so, the collaboration allowed for paramedics and EMTs to work in the hospital, and it allows for continuity of care, the continuation of care of patients. Because a lot of times in EMS, once we drop the patient off at the hospital, we don't know what happens to them afterwards. So with this collaboration and teamwork that the hospital and EMS have done, we now are able to bring the patient into the ER, and then we as paramedics get to continue care of this patient until they're either admitted to the hospital or discharged home, or even transferred out to another facility. EMTs, they get to work on the floor, they get to continue care and make relationships with the patients on the floor. And then with this community, with this collaboration, it allows us to continue training education-wise. We get to further our skills with training. We also get to utilize our skills in the ER to help keep us comfortable with doing our skills when we need to in the back of an ambulance.
Kiowa County Fire and EMS.
Welcome our panel of EMT paramedic experts to answer questions about the career opportunities you have working as an EMT or paramedic. Joining us this morning from Kiowa Memorial Hospital in Greensburg are Brian Lawrence, paramedic and EMS director, and Corbin Brown, EMT. Good morning.
Good morning.
Morning.
Thank you so much for joining us today. I really appreciate you being here. I know you're also with us at a school too, with presenting with a number of students. So thanks for double doing it this morning. Appreciate it. I wanted to start a question with you, Brian. Can you tell us about what is the difference between an EMT and a paramedic?
The basic difference is, as an EMT, we look more at providing basic level skills that can help keep the patient in the status they're in to get them to the hospital. You know, we can provide oxygen, help them breathe better, make sure their heart's working right. As far as a paramedic, we are allowed to give a considerable amount of medications that can either help the process of what's going on by slowing it down or speeding it up. We can give medications to help the heart perform better. We can give medications for pain. You know, like when someone gets hurt and have a lot of pain, we can give medications for that. So as far as advanced, we do IVs, medications, stuff to help their body to either slow down so that they feel better or help it speed up so that they feel better.
Thanks. That helps me understand the differences. Corbin, a question for you. What types of emergencies do you most often respond to in your area?
Most of them are going to be medical. We do get trauma time and time again. We don't get them very often, but I personally enjoy running traumas, but medical is just as important as is fun. You kind of get to solve the problem rather than just fix what you see in front of yourself as like a trauma.
So, and Corbin and Brian, you both, I think you mentioned this in the video, one of you did, but can you kind of elaborate a little bit, like when you say you have a 24-hour to 48-hour shift, can you tell us more about the work-life balance for an EMT and paramedic?
Yes, with our work schedules, currently we do a 48-hour shift where we're scheduled to work 48 hours and we get to go home for 4 days for 96 hours. So a lot of times when we're at home, we make sure, you know, to try and separate ourselves from work life, so that way we're taking care of ourselves, you know, self-care, whether it be as a guy going out hunting, fishing, boating, just spending time at home doing yard work or whatever, it's good to try and separate yourself from work where you don't get phone calls or requests that come back in.
So what about you, Corbin? When you're on shift, are you physically you're on like on call, or if you will, for that 24 to 48 hours? And
Yeah,
then
so
you just
the
have to be
whole-
available. Okay.
Yep, the whole stretch of the 48 you're on call. The 4-day stretch is nice though, because that third day you can use it as like a recovery day, because you really don't know what kind of calls you're gonna get. You could be having no calls your first 24, and then you're running your last 12 like nonstop. So the last 4 days are a nice recovery day before you go back.
Okay, a question for you, Brian. What skills, like you think of all the skills you had and you explained, what skills matter most when seconds count?
Whether it be an EMT or a paramedic, 3 skills matter the most in EMS. It's protecting and providing an airway, making sure it's adequate, making sure the patient can get air in and out. The next skill we have is breathing. We want to make sure their lungs are getting full, and also breathing out, exhaling, and emptying so they can get new oxygenated air in. And then our third one is circulation, which is our heart and the vasculature. We want to be able to make sure that the heart is working good, that they're circulating blood through the body, because if one of those 3 are defective, we're going to have an unresponsive patient that we're going to have to be doing CPR on. So even as a paramedic or an EMT, the basics is what's going to save us, protect us, and make us look good.
Great. Thank you so much. Now, Jaron, I know we have probably some questions in the chat for both Corbin and Brian, so I'm going to turn it over to you.
Yeah, thank you, Cindy. And yeah, several that are coming in. Let's put this first one to you, Brian. So Emily is with a group of students, and she is asking, are there weight or height guidelines or limits as a paramedic? So essentially, she's wondering, can you be too tall to be a paramedic or working in the back of an ambulance?
No. Corbin and I personally work with an individual that is 6'10", 6'11". Is it good for his back? Probably not, because he has to bend over and he cannot stand straight up inside the ambulance. Weight limit, height limit does not matter. Typically what we do look at, a lot of services are going more to a physical perspective. We want to make sure you're physically fit enough to be able to do 2 minutes of CPR manually. So height, weight typically does not matter. It's more of, are you in shape to be able to do 2 minutes of continuous CPR?
That's a great point. Awesome. Great clarification. All right. Another question from Faith, and Corbin, will send this one to you. You talked a little bit about some of the certifications in the video and your own journey that you have been on as you've kind of advanced the career ladder. Could you maybe just clarify again, what are those certifications or degrees, programs that are out there to, what do you need to be an EMT, and then some of those other steps above that?
So you can take a class, like I took mine outside of like a school. So mine was a 6-month program. So I just went in the evenings every Monday and Thursdays. It just depends on like which program you go through. You'll have to do that. The classes for that aren't very long. I think maybe 8 months is like the max stretch for that one. And then your CPR, which is a very easy class. It's just, you have to learn how to do CPR and first aid basically. But those are the first steps that you do take to get your EMT. And then after you obtain it, you can keep climbing that ladder. You can get your AEMT after that, which is what I'm currently doing. And then you can get your paramedic.
Great. That's a really helpful explanation. Thank you. Another one, as you all were talking about the 48-hour shifts, you touched on this a little bit, but in your part of the state, at least, how many calls do you typically see? What does that cadence and volume look like?
It varies. Mm-hmm. As with any service, it varies. We are a small service. We average about 300 calls a year. So roughly just under 1 call a day is what our average is. But we may go 3 or 4 days without a call. And then we may have a day where we have 6 or 7. So, and as Corbin alluded to earlier, the days off are great, because your first day of shift may have nothing, and the second day you may run all 24 hours, And so you need a day recovery. So it makes it great. But call wise, it varies with every service. Your bigger services, they'll have 15, 20 calls a day for a slow day, and they could have 20 to 30 on a busy day. Us, a slow day is none, and a busy day could be 6 or 7. So
That's a good reference point. Okay, that's helpful. Well, and maybe just time for one, maybe 2 more questions. So this next one from Shannon: how do you cope with all of the, the day-to-day, and like you said, maybe trauma isn't as frequent, but when you have some of those types of cases and situations, how are you able to deal with that? And she asks, is there mental health help for any PTSD, if there is PTSD, and is that a challenging part of being an EMT or paramedic?
Yes. A lot of your older paramedics, I don't want to say we, because I don't want to consider myself older, but we're taught that emotions aren't good. Over the last 3-4 years, there has been a big shift on mental health. I personally go to counseling for this stuff, whether it's PTSD or we actually we do a lot of work with a group called 1033, and there's a couple smaller groups in this area. They are actually first responders who are trained in mental health, and a lot of them have licenses as mental health psychologists and stuff and therapists. They know what we go through because they've experienced it. So they know there's a different approach than a typical person who goes through therapy otherwise. So yes, we do focus a lot on mental health. If we have a hard call, we've had it before where one of our technicians actually knew a victim. We will do everything we can to support them, whether it be through mental health. If they need some time off, they're going to get it. They need to cope, because we don't want to continue just to push and then cause health problems outside. So yes, over the last 3 to 5 years, mental health has become very big in it, and it is something that we do offer. We've even gone to the point we will provide mental health for the community if there is a tragic accident within the community, and it be a child or a teenager or someone in the local schools. We do work with communities also to help.
Well, that's helpful. And again, we have a lot of other questions we weren't able to get to, but Cindy, I'll need to pass things back to you. But thank you both for sharing all of those, words of wisdom and opportunities there with being an EMT and paramedic. So Cindy, back to you.
Yeah, I agree. Thank you both for joining us, Brian and Corbin, and for sharing your insights on careers working as an EMT or a paramedic.